vias aéreas, desmistificar um pouco a utilização das máscaras laríngeas versus os tubos endotraqueais, como é que funciona o selamento, né, da via aérea através dessas máscaras laríngeas, qual é o posicionamento, manhas, né, tips and tricks aí para poder estar utilizando na rotina realmente de maneira segura, né, e sem medo e de forma efetiva, né? Então, vai ser muito proveitoso. Queria agradecer a presença de todos, né? E agora, com a palavra aí, a Dawn. Depois aí, quem quiser entrar em contato com o time do comercial, a gente está fazendo também alguns preços mais promocionais em relação ao kit e vamos tentar trazer para vocês, então, nessa próxima hora, bastante informação aí para vocês estarem utilizando aí de maneira rotineira as máscaras laríngeas. Mais uma vez, obrigado, Dawn, pelo aceite e é com você.
Thank you, Robson, thank you. And thank you for TradeVet for inviting me to do this evening seminar. It's good to see so many, so let's carry on. I'm going to share my screen with you, and I'm also going to use some models, so we'll be swapping a little bit backwards and forwards. So please bear with me while I share, which hopefully you can now see. So as Robson says, I'm going to talk to you about the V-gel airway devices and how we use them and how you're going to use them in your companion animals. We do at the moment cats, rabbits and dogs, and we'll talk through a little bit on each of the species as we go through this evening. What I want to do first is to go through and say, really, what's the purpose of airway management? And it seems a little bit of a silly question. However, I think we tend to forget sometimes what we need to cover with airway management. And I think over the years, with just the use of endotracheal tubes, sometimes we're led into a false sense of security and don't remember exactly why we're doing things. The obvious one is to gain a clear and patent airway for your patient. And that makes sense. That's the common factor. We want to deliver oxygen and our volatile anesthesia agents. And we want the ability to be able to ventilate that patient if necessary, whether that's going to be a manual or a mechanical ventilation. We also want to allow or protect that patient against aspiration. And this is sometimes where we rely on an endotracheal tube to do this with an inflation of the cuff in the trachea. But we don't often, or what we forget is that that inflation of the cuff is actually only there to give us a gas seal. And that gas seal will again allow us that positive pressure ventilation, but it will also allow to keep yourselves, the staff, the vets, the technicians safe, because we're not going to have the leak into the environment. But this protection against fluid, whether it be attack from dental coolant, water from the mouth, or whether it be from a reflux regurgitation, we don't always protect. We can't protect that airway with just an inflated cuff. Again, we're going to talk about this a little bit more later. So where are our choices? Where do we seal? Airway management is about producing this seal, gaining this seal. And we can either do that very simply on the face with a face mask. We can go down a lot more invasive and go down into the trachea, or our supraglottic airway devices actually are almost a middle ground, and they will actually seal in the pharynx, sitting over that upper airway, and this is where our better protection of that airway comes in. So common concerns about airway management. One is obviously the trauma. We all know that to some degree we are going to traumatize that larynx and or trachea. There's nothing we can do about it. whenever you put an endotracheal tube, whenever you put something down through that larynx down into the trachea, we are going to traumatize it. Doesn't matter how good or how bad your techniques are, that trauma will happen. So the body, the end and the body of the tube is going to traumatize inside, and potentially inflation of any cuffs inside the trachea also put that animal at risk from trauma. We have an increase of dead space depending on how far you come out of that mouth. If you don't cut endotracheal tubes down for the individual patient, we're increasing that dead space. Also, if we're using a face mask on the patient, again, you have to consider what size face mask you're putting on, because we're going to increase that dead space. We've got to think about increased airway resistance. When we put an endotracheal tube down the trachea, we're putting a straw down a tube. We're always going to narrow that airway. The smaller the patient, the more dangerous it becomes to increase that airway resistance. You're increasing the workload, the effort for that patient to breathe. And the smaller patients, like rabbits and small cats, will struggle to breathe through that airway resistance. Laryngospasms, any animal can suffer with the laryngospasm. Cats and rabbits tend to be a little more sensitive. If you touch the larynx, we can cause laryngospasms. But it's not to say that dogs can't get it too. We tend to desensitize the area, the larynx, with a lidocaine with cats and rabbits. But certainly dogs are quite easily, can go through laryngospasms, normally seen through deep pain sensations. So if you're maybe pulling on ovarian ligaments in a bitch spay, in a hysterectomy, then if the patient is suboptimally anesthetized, a little bit light in that anesthetic, then a laryngospasm can happen as well. And of course, we want that fluid protection, as mentioned, whether it be from the front end, from dental, or whether that be regurgitant and reflux, which again, we'll go through a little bit later. So I want to show you a video. This is a video that was given to us by a UK rabbit vet. This is a rabbit anesthesia. This is a rabbit that was intubated and came round a little bit quicker than the vet expected, and he bit off his endotracheal tube. So the rabbit was re-anesthetized so that they could go and retrieve. But what I wanted to show you, if I can halt the video to show you, oh, I've gone a little bit far, beg your pardon. What I want to show you is that trauma of inside, start playing it again, inside the tracheal lining that ET tube has done. And this is fairly standard. This is a normal traumatization of that airway. So if we look inside, once the larynx has opened, look at all this bruising, this bleeding. You can see the ET tube down in here. Let's go back and play that last bit again for you. See if we can get to the end. So here inside, and this is purely the body of the ET tube that has gone on and traumatized the inside of that airway. And that's pretty normal. So reflux and regurg, the video at the top hopefully will keep playing, but you're going to see this is just a bitch spay, which we weren't expecting fluid to come up at all, but what we're looking at on the top right hand side of that video is the reflux suddenly coming out of that airway device. Now, reflux, we have to remember, is that ebb and flow of gastric contents that are coming up the esophagus. It can be acid or a bile acid being really the acid stomach contents coming up. Bile tends to be more of a yellow material that comes up. It can cause pain, especially with the acidity, can cause pain coming up. Reported incidents, nearly 70% of dogs will actually have reflux coming up under anesthesia. So it's actually quite a common situation. But it happens down in the esophagus. It's quite silent. We often don't realize it's happening actually until you see changes within the animal. Maybe heart rate's gone up, maybe respiration rate goes up, and actually you're not doing anything to really cause that. There's no changes in what you're doing operation wise. There's no changes within the anesthesia gases. So if you start seeing changes within those parameters, often have a think about it. It could be a reflux situation going on. Once it travels up into the pharynx, and that can become a regurgitant event, and that's end stage. It's more dangerous. The animal can then aspirate that down through into the airway. If we have an endotracheal at some point down here cuffed, that's when it becomes or we don't realize it becomes more dangerous, because we're relying on that cuff to deal with it. But about up to 15% of those 70% that will have it will go into regurgitation. Vets will often say to me that they see it in brachycephalic dogs with the very short faces, purely because the distance from the pharynx to the nose is much shorter, and therefore it's more common to see a regurgitant in a brachycephalic dog. But actually it makes no difference on the type of head shape. Reflux and regurgitation happens whatever the breed or head shape of the animal. So we have a choice that now we have another device. We don't have to necessarily use an endotracheal tube in every situation. So supraglottic airway devices first appeared in humans over 30 years ago. And the person who invented the i-gel, the human version, is a gentleman called Dr. Mohammed Nazir. He's a human anaesthetist who invented this. And he turned around and said, if I can make it work for animals, humans, I can make it work for animals. And so after about 8 to 9 years of research and development, in 2012, he actually launched the first product into the veterinary market. Working alongside a veterinary surgeon, it was first launched for rabbits and cats. They were anatomically shaped to fit that species. So it was the first time in a long time that the veterinary market actually had a product that was not only made for us, but actually made for the different species that we work with. We learnt a lot from that first product. We wanted to improve on some of the faults that we did find, so we actually relaunched the product to the new V-gel Advanced, where we improved an awful lot of issues that we had and that were reported back. And in 2020, the new V-gel Advanced was launched, and this has solved many of the issues, such as leakage. We've got better seal pressures, etc., especially in rabbits where we want to ventilate them. And then after a long time waiting, the dog V-gel was launched in 2022. So why do we use them? Why do we want something else? Why do we want another airway device? It was made for humans, not because humans are difficult to intubate. They're not. Humans are quite easy to intubate. The main reason we complained is because we end up with a sore throat, and many people didn't want to wake up with a sore throat. They didn't expect to. They had enough to worry about with the operation that they were having. So it was purely about comfort and no trauma of why the device was actually invented. And nowadays they're actually used in about 80% of theatre work for humans. They are in firefighters will use them. We have for resuscitation. They are used in the armies around the world, again for emergency resuscitation. And they are used in air ambulances, first response paramedics, for, again, very quick and easy gain of an airway. And we have that same advantage in all of our species, the cat, dog, and rabbit devices. The atraumatic, the ease of use, the placement is very much easier with the supraglottic airway devices. We don't get dogs going home coughing. We don't get cats after a dental being all gurgly and wet around the throat. So we get much better fluid seals, we get no trauma, we get much nicer recoveries with a V-gel device. We don't cause any laryngospasms because, as I will show you, the device doesn't touch any of that upper airway structures. We don't get the airway resistance. We are not putting anything down into the trachea. So we don't get a lot of those issues that we see with endotracheal tubes. So the biggest benefit really is the fact that these devices now seal in the pharynx, and the pharynx is a pretty tough area when you consider cats will eat mice, bones, and the hay and the straw that rabbits eat. The pharynx has to be pretty tough. So we don't have those issues. We don't touch the trachea, we don't touch the larynx, we don't touch the arytenoids, the vocal cords. So we are not seeing any of those issues. We also protect against reflux and regurg and the aspiration of that, because the device actually seals that upper esophagus. So it will halt reflux and it will stop it becoming regurgitant. And you'll see in the dog device that we have an extra ace of spades, if you like, up our sleeve with the dog V-gel. So we have a little extra protection on the dog V-gel. They're extremely comfortable. We don't have patients waking up with, say, with these sore throats, no coughing, no stridor, no horrible noisy breathing anymore. They're very much better recoveries. We also get health and safety for the staff. We get much better seal than an ET tube will do, so we don't get the leakage into the atmosphere. And certainly if you're doing rabbits and you're face masking rabbits, the supraglottic airway devices, the V-gels, much better for health and safety for your staff. But they are super easy to place. I can place a V-gel. I can place an ET tube, but I can't place an ET tube. Bear with me. I'm just trying to stop sharing my screen. I can't place an ET tube as quickly as I can do that in a cat. So they're extremely quick and easy to put in. So while I'm off sharing, let's go through the anatomy of the V-gel devices with you. I have the 3 devices here at the moment. We have the green ones, which are the rabbit devices. I have the purple ones as cat devices, and then we'll bring in the pink one as the dog device. So let me go through, as I can't hold all 3 in my hand, let me go through the anatomy of these devices. So distal end, if I can get this close enough, the distal end of the V-gel. This is the seal for the upper esophagus. So this plug pushes into that upper esophagus, and that's going to halt any reflux coming up in the cat and the rabbit device. That's going to stop any reflux coming up to protect that airway. What it's also going to do is protect the stomach against the oxygen and the volatile agent that you are using. So if you ventilate your patient, any pressure, increase of pressure with the air is going to stop you pushing that air down to inflate the stomach of your patient. We then come down to the bowl of the device. This bowl is anatomically designed to mirror the pharynx shape of that particular species. So each of the devices will look slightly different because it's following the anatomy inside that particular species. It's got a little skirt at the bottom. I'm trying to get this close enough for you to see. So this is the filling the top half of the pharynx, and this skirt is going to go down below the glottis. It cuddles the glottis, and the end of this skirt is actually bottoming out. It touches the ventral floor of that pharynx. So the V-gel goes from one side of the pharynx floor all the way around to the other side, and the glottis, the upper glottis, is inside the bowl of the V-gel. I'm going to show you this in a video and a picture in a minute. We then come down to the shoulders, and these shoulders are slightly different in all of the devices, and they have a slightly different reason for being there. On the cat device, the shoulders are quite prominent because inside a cat's mouth, you'll see when you open them, they have that paraglottal arch, that skin that divides the mouth away from that pharynx. And this is very prominent in a cat. So when I put the V-gel in and I put the airway channel on his tongue and I push that in, I'm trying to show you that those shoulders go all the way up to the point where that pharyngeal arch is. If I turn it slightly, I'm hoping you can see those shoulders are up against that skin, and I can't push this device in anymore because those shoulders are going to stop me from pushing that further. So the cat device is fairly easy to place and know that it's in the right position. As we come back to the bowl, this flap drops down the back of the tongue. So this is in the upper esophagus. The whole bowl is in the pharynx. This flap has dropped at the back of the tongue. These shoulders are against the pharyngeal arch. And then you've got the airway channel coming out of the device to the connector, where you've got some wings and some ridges that you can help tie this device in with a wide open gauze bandage, piece of string, shoelace, whatever you want to help. As long as it's non-elastic, you can tie this in with anything. The difference on the shoulders of the rabbit device, you'll see the shoulders are very much smaller. The oropharynx distance from the teeth down to that larynx in a rabbit is very long, further than you think, maybe. So we have the teeth here, and unlike our cat, the larynx of the rabbit is all the way down here. So the distance that this has to go is quite a long way. And there isn't that paraglottal arch, that skin that defines the difference between the mouth and the pharynx as there is in the cat. So these shoulders, the difference is that these shoulders will actually lodge into the pharyngeal muscles in the rabbit, and it will help with the stability of the device to help it stay in place so we don't get the rotation. So it's still fairly simple to place in. You have to have the confidence to know that the device will work to push it in. Your first challenge is to anesthetize your rabbit and open his mouth and get his tongue. But once the device, and we'll go through the technique a little bit more, but once this device is actually in, it's a long way down for that device to be in the pharynx. So those shoulders are not up against that pharyngeal arch, they're actually lodged in that muscle, and then the V-gel can't rotate. Similarly with the dog, again, dogs don't have that difference. So again, the shoulders are almost redundant. They haven't got a huge use. But what the dog V-gel will do which has the huge advantage, our little ace up our sleeve is a gastric channel. Because dogs have a much higher risk of reflux and regurg. That's where we've got the gastric channel that runs all the way up the V-gel and comes out of the connection here. So this gives us the ability to know an event has happened and do something about it. Again, I'm going to show you this a little bit later. So let me go back to share. So we have the anatomy, which we've gone through, of our V-gels, and just to show you the different points, the different anatomy of each of the V-gels. So as the V-gel goes in, how it's placed, the V-gel self-inserts. We don't actually have to visualize, look at anything. As long as the airway channel is on the tongue of the patient, so the orientation of the device is correct, so the airway is always on the tongue, however that animal is placed. The V-gel itself pushes the soft palate up. The epiglottis is disengaged and it falls to the ventral floor, the bottom floor of the pharynx. And then as it's pushed forward, the tip goes into the esophagus, and the whole of that epiglottis and whole of that upper airway is inside that bowl. And if I can show you the video on the right-hand side, this is a prototype of the cat V-gel. I'm sad it's not the beautiful purple, my apologies. But I'm hoping that you can see as we go through with our bronchoscope, you can see one side at the bottom down here. I'm hoping that you can see the bottom of that wall of the V-gel. It lines the whole of the way round to the other side, and that airway, your target for your ET tube, is actually now down inside here, and the epiglottis is at the bottom floor. So you can see the V-gel is creating a false pharynx. I describe it as an internal mask. Instead of you masking here on your cat or your patient, you've gone down and taken your mask inside the pharynx, and you're masking on top of that air, directly on top of that airway. And that's what's protecting that upper airway against any reflux, water, from the coolant from the dental, because we've totally isolated that upper airway. So very similar on the cats and the dogs. Placement is very, very similar. The rabbit, as I said, the oropharynx is a long way down, so you've got further to push the device, but the principle works exactly the same, whether it be the rabbit or the dog. The added advantage here is that you can see with the dog, we're placing a gastric channel, a gastric tube down that channel, which if you watch the bottom part of that, you will see come out into the esophagus. And this gives us our control and our knowledge about an event that could be happening. So an MRI showing you a dog V-gel in place. You can see I have the V-gel in pink. I have my airway channel. I have my gastric channel coming in here. The tip has gone into the esophagus. I have my seal down over my airway. So I now have two seals. I've sealed the airway channel, so I've got the epiglottis, sadly in pink too, but the epiglottis coming up here. You can see our larynx is in this point is actually closed up as the animal's breathing, and then you've got the second seal here of the esophagus, and the gastric channel and the airway channel are totally separate. So if we do get fluid come up from the esophagus, it actually physically cannot go down the airway of our patient, because it will come out of that gastric channel, and like you saw on my video earlier, you'll have a lovely mess of gastric juices on your operating table, but better there than down the airway of your patient. One of the advantages of having that seal much higher up is we have less trauma. If we don't touch the larynx and we don't touch the trachea, we can't harm them, we can't traumatize them. And also you actually have far less accumulation of water, because when you have an ET tube that's cuffed, you've got no protection of that upper airway, and therefore any water from a dental or from reflux is actually going to go down that upper airway to the point where the cuff is. So you're always going to have a degree of fluid going down as we deflate the cuff, as we remove that device. So talking a little bit more of this gastric tube point, it is only in the dog version. The cat and rabbit version, sadly, there's not enough room. The anatomy doesn't allow us the room to be able to put this extra channel down there. However, brilliant on dogs, where we have, say, nearly 70% of dogs will have some form of reflux going on. So what this device allows you to do, you have lots of choices. You can now turn around and put the device in your patient, and like our bitch spay was there, you see the animal upside down on the table, and you can leave the device open and not put anything down there, down this channel at all. If you have an anesthetic machine that has a temperature probe on it, or you wanted to use an esophageal stethoscope, that's fine. You can place that down. It's a 12 French gauge channel. So if you wanted to pass a tube down that gastric channel, absolutely fine. However, if you do have reflux that is going to come up high enough to come to the tip of the esophagus, the upper esophagus, then that fluid will run down this channel all the way down to the connector, and you'll have this lovely mess on your table. But you know an event's happening. So then you have the ability to pass the gastric tube down through the connector and out of that esophageal seal at the end. And that means that when you have your tube going down, it means I can suction out, I can test the fluid for acidity. You can use your urine dipstick and you can check for pH or acidity. If it is acid or alkaline, you'll know then what to flush that with. If it's alkaline, I'm just going to use a lukewarm tap water. If I've got more dangerous and more irritant acid, then I'm going to use an IV fluid. And you can flush that out. You can suction all that fluid away. And then if you wanted to medicate that patient all the way down the esophagus to negate that reflux, that acidity, then you can do. So that tube and that gastric channel gives you the knowledge and the ability to deal with any reflux and regurg that is potentially happening. So just to show you some of how easy it is to place on some of our patients, I have to say I love the recovery of the cats. In 12 years, I've actually never taken a V-gel out of a cat. They take them out themselves. They just spit them out, as you can see here. So once that cat has the ability to be awake and spit it out, you just help and remove from the mouth. Rabbits, again, super easy to take in and out. Very good for dentals. You can have the movement around. Dogs, I find easiest way to know the device is in is watch the throat, because as you watch the throat, you see the V-gel actually drop down inside the larynx or the pharynx of your patient, and the larynx just drops. So you can either watch the device fall off the back of the tongue, or you can watch the device on the throat and see it drop down onto the throat. Dogs don't have that same ability, that same reflex to gag and spit the V-gel out. So I'm looking for reflexes such as ear movement, tongue movement, palpebral, eye comes back up, jaw tone will come back. And once these patients are starting moving their head around is the point where I'll take the V-gel out. As we mentioned, dentals are superb with the V-gel because we've got that watertight seal. As I play this video, you've got a live internal feed of a bronchoscope inside that patient's throat, so you can see that there's no water inside the bowl of that V-gel as this dental is going on. I still place the cat's head down, or the dog's head down as I do it. We'll sometimes suction the mouth out. I'll swab the mouth out before we turn the patient over. Device like like your ET tube will be disconnected from your anesthesia circuit, and it will be turned over with feet under. So you're still going to have the same precautions like you would in an endotracheal tube. It's just that now I don't have to throat pack again water because the V-gel is doing that for me. The one thing the V-gel is extremely useful for is a resuscitation device, and this is certainly one of its big uses on the human side. Because it is so super easy to place the device, then it's very good when cats come in or dogs come in from a road accident, or they've collapsed and they've stopped breathing. It's very easy to teach somebody in a first aid situation to put a device into this patient. It doesn't matter on the depth of the anesthesia, certainly for cats and dogs. I tend to find rabbits have to be a little bit down. We can't have any reflexes on rabbits, otherwise you'll never get the V-gel in. But cats and dogs, extremely easy to place. And you can actually, if you've got a laryngospasm happening as the patient is waking up from an endotracheal placement, and if you've taken it out maybe a little bit late and a laryngospasm has happened, you can actually put a V-gel very quickly into this patient, put it back on oxygen and ventilate it with some volatile agent to get the patient back down under anesthesia, and the laryngospasm will cease. So they're extremely good for emergency resuscitation. So when would I use a V-gel and when wouldn't I? It's probably easier to say when I wouldn't use one, because for most anesthesias, they're extremely good. But if you have a situation where you have a non-functioning airway, or an airway that wasn't working properly, collapsed tracheas, if you have brachycephalic dogs, sometimes we'll have one larynx working and one arytenoid not working. So both sides must be working for you to use the V-gel. If you're using a neuromuscular block in your anesthetic protocol, you shouldn't be using a V-gel. If you wanted to pass a gastroscope, the V-gel is going to block that upper esophagus and stop you going down. In the same way, if you wanted to look inside the throat or the pharynx, place a pharyngeal feeding tube, do BOAS surgery for brachycephalic airways. You cannot do that with the V-gel in, because it's going to be in the way. GDV, gastric dilations, are extremely useful with the V-gel. I would be using 2 devices because you have to decompress the stomach very quickly. You need to pass an ET tube first, pass your tube to decompress the stomach, but now you've opened that sphincter of the stomach up and you're going to encourage fluid, because these dogs often haven't been fasted because they're emergencies. You are going to welcome reflux to come up. So if you now swap, once you've decompressed the stomach, you swap to a V-gel, that's going to give you the protection against that reflux and regurg and aspiration of fluid. So for me, I would be using both devices. Where I would definitely be using a V-gel is emergency resuscitation, bronchoscopy, pass a bronchoscope inside and still have your patient breathing. Certainly high risk of reflux and regurg, and definitely dentals. Any dental work on dogs, cats and rabbits, V-gels are absolutely brilliant for, much safer. So your sizes, you have 6 sizes on cats and rabbits, and you have 4 sizes at the moment on dogs. So cats, we have a C0, 1, 2, 3, 4 and 5. We go on ideal body weight of these patients. It follows the rule of an airway device. If you have a patient that will fall into 2 categories weight-wise of a V-gel, always use the big one that you can get in safely. Exactly the same rule as an ET tube. So the bigger device that you can get in safely. But if you can always sort of go with the bigger device, but look at the ideal body weight of your patient, maybe not the actual if it's a slightly overweight or underweight patient. Rabbits, exactly the same. We have 6 sizes. That again will give you from a ½ kilo Netherland dwarf baby right up to the very large breeds. Again, there is an overlap in weights. Look at the ideal body weight for the head size of the patient, and the chart is a very good starting point for you. Again, always go with the biggest device. Come down if you have to, and with experience you'll get to know the right sizes. With the dogs, we're going to look at the head shape and then the ideal body weight. So we have 4 sizes at the moment. We go from a D3, 4, 5 and 6. This will take me from roughly a 5 to 25 kilo dog. We will be bringing out a D1 and 2 for the smaller dogs. The larger breed of dogs at the moment, you can't use a V-gel on. So any dogs over 25 kilos at the moment, you can't use a V-gel on. They're not available for the larger dogs yet. But you look at the head shape. Are you dealing with a brachycephalic, a mesocephalic, or a dolichocephalic breed? In with the brachycephalics, I would also include the dogs that have done the weights for all of their lives and they've got no neck because they're solid muscle. So I'd be looking at the bull type breeds, the bull terriers, the Rottweilers, the real thick muscular head shapes. And then they say you look at that ideal body weight within that head group, go along and it will tell you what D size V-gel to go with. The devices are a single-use device. We do recommend that they're used as a single-use device. We're not the police. We can't make people use them single-use. However, I would say if you are going to consider using them, then I would ask you to look at that device very carefully. Look down the airway channel. That airway channel should be clear, clean and smooth. If it is, it's your choice if you wanted to reuse it again, but don't expect them to last as long as an endotracheal tube, because they won't. You'll get a handful of uses out of them maybe, but no more than that. And please make sure you discard the V-gel if it looks any different than when it was from you. They are recyclable. They're made out of recyclable material. So if your local area and recycle bin allow you to put medical devices in them, they are made from recyclable material. And to end on, just to give you a little bit of confidence, I guess, is that the V-gels, our V-gels are, so we sell them now to over 50 countries around the world. We have 40 countries that have authorized distributors. They're placed and taught in over 60 vet schools and universities around the world. They're in the certainly in the UK, they're in veterinary nursing exams. They have to know about them for exam papers now, and they're independently presented in meetings, speciality meetings around the world. So independent of ourselves, which is nice to see. So I think that's me finished for the most of it, and I'll be happy to take questions.
Hello. Muito obrigado. Deixa eu... Espera aí. Muito obrigado, Dawn, por toda essa troca de informação. Muito bom para a gente receber informações assim de quem vive o dia a dia aí das máscaras laríngeas, né? Que atua na rotina, está aí ajudando aí muitos mil veterinários, né? A estar utilizando esse tipo de dispositivo, né? A Débora acabou de perguntar em relação à esterilização ali. A Dawn, ela finalizou ali no penúltimo slide falando que realmente eles não são autoclaváveis, né? Eles são, diferentemente dos dispositivos antigos, né? A Dawn até pode falar um pouquinho melhor disso daí, mas que eles eram feitos de silicone, né? Hoje eles são produzidos por elastômeros, são termoplásticos, né? Então são como se fosse um tipo de plástico que ele é muito similar ao silicone em relação à flexibilidade, em relação à mobilidade dele, mas ele não é resistente à temperatura. São produtos que são termosensíveis, né? Então, eles existem em formas, né, para você formar ele, né? E a partir do momento que formou, ele é formado através de uma temperatura também. E depois que se submete, então, a uma temperatura alta, eles acabam perdendo essa mobilidade e perdem até mesmo a sua forma original ali, né? Esclareci de maneira coerente, dá um...
You did very well, Robson. You're quite right. They will melt. In an autoclave, they will melt. Yeah. End of story. So please don't put them in an autoclave. Robson is absolutely right. The original ones were made of silicone, and they were allowed to be autoclave. They would take the autoclave, and we could reuse them. But part of the reason for changing them was to try and improve the seal pressure, and to improve the seal pressure, especially for the rabbits and the kittens, where we wanted the better seal pressure to ventilate these guys. We wanted to, we had to improve that seal pressure, and therefore we had to change the material. So the material, Robson is perfectly correct, is a TPE. And it reacts to the patient's temperature to mold anatomically to fit that individual patient. So that's why we get the better seal pressures with these devices. But sadly, TPE cannot be sterilized. So most people, if they do want to reuse them, I can't give you a cleaning protocol. A lot of people will try and clean them in the same way that endotracheal tubes are cleaned. But please, as I said, look at them, look inside that channel, look up to a strong light. The minute that starts looking a little worse for wear, a little bit sorry for itself, you've got to discard it. And don't expect these to last as long as your endotracheal tubes, because they won't.
Tranquilo. Dawn tem uma outra pergunta também, e até interessante, bem pertinente a pergunta, né? Quando a gente fala da utilização da máscara laríngea, né, tanto para cães, coelhos e gatos, a gente fala de pacientes com uma anatomia normal, né? Então, essa questão que veio à tona é realmente da sua utilização em pacientes com o palato mole, né, alongado, né? Esses pacientes, então, eles sofrem de uma doença, então, anatomicamente, eles são diferentes. Então, o V-gel, ele não está adaptado à anatomia de um paciente com uma doença, e sim como um paciente saudável, né? Então, se você quiser explicar um pouquinho mais a respeito disso daí.
So you can, so typically we talk about the brachycephalic, the squashed face patients that have a lot of folds and elongated soft palates. As I said, the V-gel is absolutely fine for these patients. It will push the folds and the elongated soft palate out of the way. That is not a problem at all. The problem comes is for some of these dogs that they don't have a working airway. So some of these brachycephalic dogs will only have one side of the larynx that works. So as long as it is a working airway, it doesn't have to be normal, doesn't have to be absolutely perfect. It could have a lot of folds, it could have elongated soft palate, is fine, but as long as it has a working airway, then I would use the V-gel. But if you needed access, if you were going to be operating on this soft palate, you cannot be using the V-gel because it's going to get in the way. So if you had a brachycephalic dog with an elongated soft palate, but his airway was working perfectly, and you were going to be neutering this dog, fine, I'd use a V-gel. Does that answer your question?
Eu acho que sim, né? Sim, sim. Tranquilo. Pessoal, tem mais alguma dúvida aí? Ninguém? O pessoal tá meio tímido. Não, mas foi bem interessante toda a conversa, não, falando assim, principalmente sobre as diferenças entre as espécies, né? Então, a gente espera, é claro, anatomicamente, máscaras laríngeas com tamanhos diferentes, né? E eu queria só que você contasse um pouco também em relação à história do que tem, um pouquinho de maneira rápida, assim, que você comentou inicialmente que foram produtos que foram desenvolvidos para uso humano e começou então a ter esse estudo anatômico, né, em relação às pequenas espécies de animais de estimação, né? E contar um pouco como é que foi essa transição, então, do V-gel da área, a máscara laríngea da área humana para a área veterinária, né? Porque a gente começa a perceber hoje que começam a entrar alguns outros produtos que são similares, né? Então, assim, por trás do que a gente tem muita coisa por trás, né? Em relação a estudo anatômico, em relação a biomodelos para tentar encontrar a melhor solução, né? Então, assim, existe uma ciência, né, e um estudo extremamente grande, não somente em relação ao formato, né, o pessoal encontrar esse produto pronto, né, dessa forma, existe por trás muito estudo, assim, né? Então, assim, queria que você contasse de maneira rápida, assim, basicamente um pouquinho sobre isso daí, a gente entender, assim, o que tem por trás disso daí, né?
Yes, so again, the human studies, first, it's very nice, I think, for veterinary salespeople and now vets that we've actually, say, have a product that has been made for the vet market. This has been a long time coming. So the Dr. Nazir, the human anaesthetist who invented the human one, as I said, it was purely because people woke up with a sore throat from an endotracheal tube and they didn't want that. So he actually worked, sadly, you have to work with cadavers. So a lot of x-rays are taken, the shape is done, cadavers were cut down and the anatomy is looked at very, very carefully. And that's what we have to do on the veterinary side as well. So we work with a lot of cadavers initially. We work with a lot of x-rays, a lot of MRI, and the shape is obtained first. And then we work with a lot of prototype devices We have to marry and mold the device into the shapes of these cadavers before, and this device has taken the rabbit and cat devices have taken about 9 years worth of research and development to know, is the shape correct, is the material that we're using, is it safe, are we getting a good enough seal, are we getting no trauma. And every time trials are done on cadavers first, before we even, 5 years down the line, before we even tried them on live animals. So a lot of research was done first. Once we start trying them on animals, a lot of those sadly were terminally ill, so we knew they weren't going to be woken up. So we could work with these patients to get the device working correctly first, and then we could look at the anatomy and look at the patient afterwards once that patient was euthanized. So a lot of work has gone into this, and a lot of research to make sure the device is actually safe. And we don't get the reflux, the regurg. We've got an absolute perfect seal at the top of that airway. So the dog device, the dogs are extremely difficult with the amount of head shapes and sizes and breeds and length of noses. And dogs' anatomy is actually even worse than rabbits, because the epiglottis on a dog actually doesn't sit as well and is as flexible as a cat or a rabbit. So one of the challenges we had with the dog V-gels was how the epiglottis sat once it disengaged from the airway, and there had the potential of blocking the airway. So the device had to be shaped and had to be the correct shore hardness of this material in order to gain a good enough airway to cope with, to have as minimal sizes, minimal shapes to fit all these different thousands of head shapes in dogs. And the dog V-gel has taken about 11, nearly 12 years to actually develop this product and come out. But we weren't going to bring out a product until we knew it was absolutely safe, it worked, we knew it ticked a lot of the boxes, and we could guarantee that it would work and would be safe for all of these patients. And that's really where a lot of the work for the veterinary side has come from, is just a lot of hard work and a lot of cadavers and a lot of time, but we know they're safe for these patients now. So anything else that comes up, we have a lot of because we know these work, we have a lot of patents. So the V-gel is very well protected and patents all over. But if you use the original V-gel that are sold by authorized distributors such as TradeVet, you know that you've got a product that is patented, safe, and we know that will work. And you'll also have the support from Robson, his team. You'll have the support from Docs Innovent here in the UK, that we can help you with any issues or any training that you need to become an expert in using the V-gels.
Ah, isso aí. Muito obrigado, Dawn. A gente milita, né, então, aí pela área veterinária, né, que milita aí por estar tendo os melhores produtos sempre e tudo, né? A gente sabe o quanto existe de ciência por trás disso, né? A gente, quando olha um produto, né, eu principalmente, né, que vivo isso de desenvolver novos produtos, de trazer o que a gente tem melhor para a medicina veterinária, a gente está num limbo ainda onde não existem processos regulatórios, né, de produtos para a área veterinária, assim, né, mas existe muita ciência, muito suor, muito tempo gasto com o desenvolvimento de produto, né? Desenvolver um produto, né, a gente receber um produto pronto é muito fácil, né? A gente que milita por isso sabe o quanto é difícil o dia a dia de prototipagem, de estudo, né? Então, assim, eu queria parabenizar a Docs Innovent, em nome de todos os colaboradores que trabalham junto com vocês, assim, o esforço diário de a gente ter realmente um produto com uma qualidade que realmente a gente tem segurança para poder estar utilizando no dia a dia, onde a gente realmente precisa, né, de ter isso daí para um produto, né? Então, a gente sempre milita por isso daí, por trazer produtos que são de extrema qualidade para o mercado veterinário, e é um prazer enorme ter essa parceria com a Docs Innovent, de conseguir trazer os produtos, de a gente estar comercializando no Brasil, né? O pessoal até comentou ali em relação à parte de preços e custos. Infelizmente, a gente vive num país onde taxas de importações, impostos, eles são extremamente altos quando comparado com outros países, mas a gente tenta fazer sempre o melhor, né? E a gente, quem quiser aproveitar, a gente está fazendo algumas promoções em relação ao kit do V-gel também, então quem quiser, na sequência, estar entrando em contato com o pessoal do comercial e poder estar adquirindo as máscaras laríngeas, aí pode ficar à vontade. Só deixando para todo mundo também que a gravação, que essa live, esse encontro que está sendo gravado, né? Então, a gente vai disponibilizar isso aí também nas nossas plataformas depois. Eu acredito que não tenha mais nenhuma pergunta que tenha ficado para trás. Se alguém quiser perguntar mais alguma coisa, esta é a hora. Ninguém mais. Então, queria agradecer mais uma vez, então, Dawn, pelo seu tempo, por todo o esclarecimento que você trouxe. Muito obrigado mesmo. Foi um prazer enorme estar aqui com você nesse momento. Agradecer o Paulo aí a tradução, né, da equipe do Verbalize. E é isso aí. Se o pessoal quiser entrar em contato com o pessoal do time comercial depois, pode falar com a gente. E quem tiver também qualquer dúvida, pode estar mandando para a gente depois no direct ou pelo WhatsApp. Fiquem abertos a qualquer coisa aí daí.